Hey guys, today we're going to talk about alopecia areata, a pretty common form of hair loss. Hair loss is very distressing to go through. On this channel, I have a whole playlist dedicated to hair loss where we talk about all the different types of hair loss, different hair loss treatments that actually work. But one I haven't given enough attention to that's relatively common is, well, alopecia areata. What is it? It is autoimmune hair loss. Basically, the immune system gets a little confused and decides to attack your hair follicle, and it results in, well, hair loss. This mostly will affect the scalp, the beard, but truthfully, alopecia areata can affect hair follicles on any part of your body. Leg hair, underarm hair, pubic hair, eyebrows, eyelashes. It typically starts as a small, round to oval, completely bald patch that may be unnoticeable depending on where it is, or it may be quite obvious. The patch is completely smooth. Alopecia areata usually begins in kids or young adults, but it can happen at any age. It's actually the most common hair loss disorder in children. Alopecia just means hair loss. Areata means patchy. So this is a patchy form of hair loss. Alopecia areata affects everyone differently. The way it happens for one person can be totally different for another. And the way it happens may be described in a certain way. For example, alopecia barbae refers to alopecia in the beard area. Ophiasis type, or alopecia ophiasis, refers to alopecia areata where you have a strip or a band of hair loss on the scalp. Alopecia totalis means you have completely lost all hair on your scalp, whereas alopecia universalis means you have lost hair everywhere. Scalp, eyebrows, eyelashes, body hair. If you're dealing with this, what you probably want to know is my hair ever going to grow back? It can. Alopecia areata, the good news is, while it's an autoimmune attack of your hair follicles, it doesn't completely destroy them. It doesn't result in the formation of a scar. So you can get hair regrowth. The hair can even go back to completely normal, a thing of the past. Some people will regrow their hair in those bald patches and never ever experience another episode of alopecia areata again. Whereas for other people, they'll experience the bald patch of alopecia areata, they'll get it to regrow completely, and then later on, they'll have another flare of alopecia areata. They may develop a bald patch in the same place or a different location on their scalp. They may even develop multiple bald patches. A lot of people go through this cycle throughout their life of getting a bald patch, losing their hair, then it regrows, then it stays calm for a while, then they experience a relapse of the alopecia areata. This is often the case for a lot of people. Many people will experience a relapse within a year of regrowing, most relapses occurring within at least 5 years. This can be really distressing for patients to cope with, experiencing these bouts of hair loss, regrowth, and then hair loss again. Hair loss is super distressing. It feels like you're out of control. It's emotionally distressing. And then people, of course, make unwanted comments about your appearance. And it's a lot to go through. It's very stressful. When the hair starts to regrow, it can come back in a slightly different color, often white or blonde, and maybe even has a slightly different texture. However, with time, your hair will go back to its normal color and texture. Because alopecia areata affects everyone differently, how long a given relapse lasts also varies from person to person. The hair may regrow on its own within a year, whereas for other people, hair regrowth requires medications. Because the hair regrowth process can take time, some people want to have treatment to hasten the onset of hair regrowth. Make sure you stay tuned to the end of the video because I'm going to be talking about the treatments for alopecia areata. With treatment, however, most people will start to see some signs of hair regrowth within about 6 weeks if the treatment is effective. However, of course, it's going to take more time for the hair to completely regrow. How long until you get another relapse? The time in between relapses, again, varies from person to person. I want you to keep that in mind because a lot of times you will see people singing the praises of a particular treatment, topical, something they bought in the store, dietary supplement, claiming that it just completely reversed their hair loss. If they're dealing with alopecia areata, it could totally be guilty by association due to the natural course of how alopecia areata can go. Your hair will spontaneously start growing again, and it's like, oh wow. And for some people, once it starts growing again, they never experience the bout of alopecia areata again, whereas for other people it's totally different. So anything someone says that they tried and worked for them, unless it's an evidence-based treatment, you really have to strongly side-eye it, because for a lot of patients, their hair will just start regrowing again and it'll be a thing of the past, especially kids, teenagers, young adults. How do you cure alopecia areata? There is no cure for it. As it stands now, there is no cure. We have treatments that can control it, that can get the hair to regrow in cases where it's not spontaneously growing back, but there is no cure. The root cause of alopecia areata is autoimmune disease. It's an autoimmune process. What that means is that the immune system gets confused, thinks a part of your body is foreign, and starts to attack it. This can be related to your genetics. Some people inherit genes from their parents that make them predisposed to have an immune system that gets confused. A lot of times, wellness accounts, various influencers will badmouth physicians and say, we don't treat the root cause. This is the root cause. You can't necessarily go in and re-engineer your genetics, your immune system, to stop doing this. Not to say there will never be a cure. We have so many new amazing therapeutics, which I'm going to talk about in today's video, and old amazing therapeutics that we still use, and we are constantly learning about this disease, but it takes a long time and the mechanisms are complex. So it's not going to be as simple as taking a supplement, tweaking your diet, going on some sort of restrictive diet where you only eat these categories of food or you eliminate X, Y, and Z. That can just lead to more hair loss because you may develop a micronutrient deficiency, develop a telogen effluvium. So don't fall for those things. What are the signs and symptoms that you need to be on the lookout for when it comes to alopecia areata? I've talked about a lot of different types of hair loss on here, and I've pointed out before that it's possible to have more than one type of hair loss process going on. For example, you may have alopecia areata, but you may also have androgenetic alopecia. So two things going on at one time. So what are the signs and symptoms of alopecia areata? Well, like I said, all of a sudden you notice a bald patch. Mostly going to be in the scalp, the beard area for men. Completely bald, usually oval to round in shape. You can have some itch, some tingle, some burning sensation. You also may develop some irritation, especially in the eyebrow area. Remember, this is an autoimmune process. The immune system's coming in around the hair follicle, can generate some inflammation preceding the hair loss. The hair loss is hair loss that all of a sudden comes out all at once. With alopecia areata, the immune system also likes to play around with your nails. So it's not uncommon to also have nail changes with alopecia areata. The nails can become brittle, thin, feel like sandpaper. If you look very carefully at them, you can see these little pits. What are the risk factors for getting alopecia areata? A lot of the risk factors are correlation, not necessarily proof of causation. Extreme stress. When you are stressed out, your brain releases signals to the body, peripherally, that impact how your immune system functions. So it's not uncommon to have alopecia areata come out after a stressful life event. Emotional stress, physical stress. Maybe you were in the hospital, had a fever. It's not uncommon. Because it's an autoimmune attack against the hair follicles, patients who have alopecia areata, not uncommon for them to have other autoimmune diseases, especially autoimmune thyroid disease. If you have autoimmune thyroid disease, more likely to have alopecia areata. Also, vitiligo. I have a whole video all about vitiligo. Check it out. If you have psoriasis, an inflammatory condition with skin and nail findings, usually well-circumscribed scaly plaques, often on the elbows, the knees, the rear end, the scalp. Nails can be very crumbly. Those patients also can go on to develop alopecia areata. Then you have folks who have what we call atopy, which includes hay fever, asthma, and atopic dermatitis, commonly referred to as eczema. If you have this or the family of these atopic conditions, you're at a greater risk for alopecia areata. Some cancer patients are treated with a medication to treat their cancer called nivolumab. And this drug can trigger alopecia areata. It does so in about 1% to 2% of patients who get this drug to treat their cancer. While hair loss is very distressing to go through, developing alopecia areata on nivolumab is actually a good thing. It's kind of a clue that the drug is working to target your cancer. One big association, and again, association doesn't prove causation, but one strong association is in people who smoke, specifically people who smoke for 10 or more years, 5 or more cigarettes a day. They have a really, a much greater association with alopecia areata, probably because when you smoke, it messes around with your immune system. And so don't smoke. How do we go about treating it? Well, one of the things we do when patients have alopecia areata is make sure their thyroid is okay. And if you have alopecia areata, your thyroid labs may be screened more routinely. The treatment path depends a lot on how extensive your alopecia areata is and your age. Children, as I said, this is the most common type of hair loss that children experience. The treatments we use in children, slightly different. The first treatment is to do nothing. The wait and see approach. As I said, a lot of people, their hair will regrow, and the treatments may make the hair regrowth happen a little bit faster. So if you have 1 or 2 patches, especially a young child, a young adult, the wait and see approach is a reasonable thing to do because oftentimes it regrows, especially in young kids. And why expose yourself to medications, treatment interventions, only to possibly have it regrow a little bit faster? Treatment, as a side note, does not guarantee that you won't have a relapse. Treatment does not necessarily prevent relapse per se. Some treatments may reduce the risk, but for kids 10 years of age and younger, typically what we would do is a topical steroid to the bald spot twice a day. Then once the child starts getting regrowth, also you can add on minoxidil. Minoxidil will help to keep the hair in the growing phase a little bit longer and may ensure that the hair, gets a good fighting chance of regrowing. Kids 10 and up, depending on the extent of hair loss, we may offer something called contact immunotherapy, which I'll explain what that entails in a moment, or a new class of medications called JAK inhibitors, which are approved for kids 12 years and older. One of them is, and I'll explain that in a moment. If you're an adult with patches, multiple patches, one thing that might be offered to you most likely is intralesional steroids. Basically taking a steroid medicine, injecting it directly into the scalp, down to the follicle to silence and quiet that autoimmune attack. And this involves you coming in every 4 to 6 weeks. Intralesional steroid injections are one of the most effective treatments at getting regrowth. Usually about 80% of people respond to these. Usually every 4 to 6 weeks you get the injections. You can usually start to get regrowth within about 3 months. So the other option is the topical steroids. Topical steroids need to be applied twice a day to the area. They don't work as well in adults, but they can definitely help in kids. Then there is something you can put on called anthralin. And the way you do this is you apply the anthralin to the bald patches. You leave it on and then you wash it off. A short contact therapy approach causes a lot of irritation, a lot. And that irritation is hopefully kind of helping to redirect your immune system to start ignoring the hair follicle so your hair can regrow. This is often coupled with minoxidil to get the hair in the growing phase of the hair cycle and get better results. Now, when you have extensive alopecia areata, many patches, or you have alopecia totalis, meaning all of your scalp hair, this is a time where contact immunotherapy may be recommended. And again, I pointed out that this might be something that is offered for kids with extensive alopecia areata. So what this involves is you go in and we put something on the skin that causes a lot of irritation, a reaction. The first visit is something you have to have applied in office. The first visit, we apply it to a small area to get your body to react to it. Once you have that reaction to it, then you come in weekly and have it applied in office. It's not something you can do at home. You have to come in weekly. And what happens is you go home and you cover the area, the scalp, for 48 hours. You're gonna develop a rash. That's the goal, to develop a rash. And that rash will usually resolve within about 36 hours. You do this weekly, so it's kind of involved, actually. It's not right for everybody. It's involved and, it's uncomfortable. But this can actually get pretty good regrowth. So the treatment is continued weekly until your hair completely regrows. If you don't respond to it, however, after 6 months, then we call it quits. Then I want to talk about JAK inhibitors. This is a newer class of medications. We have 2 of them that are FDA approved for alopecia areata. JAK inhibitors help to target specific aspects of your immune system to calm down that autoimmune attack. Not only are they used for alopecia areata, but they're used for other autoimmune diseases, including vitiligo. Not only is this helpful for hair loss on the scalp, also for anywhere, including the eyebrows and the eyelashes. You have baricitinib, which is approved for adults with alopecia areata. It's a pill you take once a day. And you have ritlecitinib, which is approved for adults as well as for kids 12 years of age and older who have extensive alopecia areata. And this also is a pill that would be taken once a day. So JAK inhibitors, like I said, they target the immune system in a very specific way to kind of calm down the autoimmune attack. But there are also several other medications that have been more commonly over decades used to treat alopecia areata, as well as other inflammatory skin conditions. Well, first of all, prednisone. Prednisone can actually be pretty effective, but it's not something you can be on indefinitely long term because it has a lot of side effects. It's an it suppresses the immune system pretty strongly. Then you also have methotrexate. Methotrexate is something we use to treat psoriasis, and it also can be used to treat alopecia areata, as well as a drug called cyclosporin. So these are additional options, pills that you take by mouth. Not going to be right for everyone. They have certain side effects, but maybe something that's offered to you. These are drugs that we've been using for many years. So there's that. All right, when it comes to the lash loss, you also have, in addition to the JAK inhibitors, which can help, you also have, well, false eyelashes. And you know, when we think about eyelashes and false eyelashes, you're probably just thinking, oh yeah, whatever, cosmetics. But when you lose your eyelashes, it really can have adverse effects to your eyes. Lashes are really important for keeping stuff out of your eyes. So when you lose your lashes, as well as brows, you can develop a lot of eye irritation. So false eyelashes can help replace that temporarily. Risk there is you can develop an allergy to the glue, but certainly an option. Suggest wearing glasses to protect your eyes. Make sure you wear sunglasses as well when you are out during daylight hours to protect your eyes from the sun. Bimatoprost or Latisse can also be used to regrow the lashes as well as the brows. Now, Latisse does have side effects of irritation, hyperpigmentation, but it can be really useful for the lashes. Now, for the brows, I already mentioned Bimatoprost, Latisse. Also, with the brow area, you can get injections directly into the brow area and get regrowth, similar to the scalp injections of the steroid medicine. You can also get artificial eyebrows that you just tape on there, and you can do microblading. Microblading is a semi-permanent tattoo, involves deposition of these pigments, lasts anywhere from 6 months to a year. A lot of people, though, are not necessarily super happy with the way it looks after a year once those pigments start fading. You know, the skill set of the person doing it is paramount, but that's definitely something that a lot of people end up pursuing. And then, of course, makeup. You know, you can paint your eyebrows on with eyebrow cosmetics. All right, guys, so that's what alopecia areata is. The root cause, autoimmune disease, things that may be associated with it, trigger it, how to recognize it, and the treatments. If you're dealing with any type of hair loss, make sure you see a dermatologist, you get the right diagnosis before you go trying things, because the earlier things are intervened on, the better the likelihood you have of regrowing your hair, of success. Alopecia areata is not scarring, but other types of hair loss are. And so you don't want to miss out on an opportunity to treat those early and prevent that scar. That way you guarantee a chance, at least, of getting hair regrowth. Because once those hair loss disorders, once they form a scar, you can't get regrowth in that area. So make sure you have the right diagnosis, and you stay consistent with your dermatologist with treatments that they recommend. you come in regularly. Like for example, if you were getting contact sensitization therapy, immunotherapy, where they apply it to your scalp once a week, it's a pain to come in, but you've got to stay consistent with those appointments in order for the process to work, to generate that irritation that kind of retrains your immune system to go away from your hair follicle. Anyways, guys, I hope this video was informative. On the inside, I'm going to put my recent video all about frontal fibrosing alopecia. In other words, if you have noticed that your hairline is receding, you are definitely going to want to watch that video next, because we talk about a commonly missed hair loss disorder. So watch that one next. But if you like this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.